Thanks for tuning in to the Strong and Kind podcast. This week we had Dr. Mary Hagerty. Dr. Mary is a doctor of physical therapy. She is a pelvic floor specialist. She's also my wife. We talked about strength training, pelvic floor therapy, the pelvic floor and misconceptions about the pelvic floor, stress, and a bunch of other awesome topics. We had a good conversation. It was definitely fun to chat with her and talk about what she's passionate about and how she helps people. So I hope you check out this episode. Let me know how you think it went. You can follow me here on YouTube or on Spotify. Subscribe to the Strong and Kind podcast there. And you can follow me at dave.strengthandkindness on Instagram. Thanks so much for tuning in. I appreciate it. All right, Mary, briefly give me your elevator pitch.
Oh, wow, you're really jumping right in. So I help women, particularly women surrounding the time of pregnancy, preparing for birth and postpartum, live strong, confident lives,
There you go.
and doing so without pelvic floor symptoms getting in the way specifically, because that is quite a barrier for a lot of women.
So I like that. That was good. That was you let that fly. I'm proud of you for that. Um,
Thank you.
what like take me through the trajectory of just like your becoming a physical therapist. What made you pursue that profession or this profession? Or we're both physical therapists, but what made you pursue this profession? Um, and then like what has kind of brought you to what you're doing now?
Hmm. Okay. Well, physical therapy, we'll just start there. So I decided to be a physical therapist, actually because of a poor physical therapy experience that I had. So I hurt my ankle in high school, and it interrupted my ability to dance. So dance it's been my thing since I was like 4 years old. And in high school, I had an injury, and the physical therapy that I experienced was like trying to get me to like walk normally and like function like a normal human. And like that's just not what it means to be able to dance again, right? Like you have to be able to point your feet and maintain releve, which for people who don't know dance, like it's just being on your toes, right? Like there are things that you have to do as a dancer that like normal people quote unquote don't have to be able to do. So that kind of inspired me to pursue physical therapy. I was interested in it. I liked the idea of like exercise, rehab, um, non-medicinal options to treat like pain and injury. So danced in college, went to PT school, um, and did the thing. Started an outpatient PT. But one patient stood out to me. So this was kind of a turning point. It was like, pelvic health might be something that I'm interested in. I had a patient in clinic who came in debilitating hip pain, debilitating. She could barely walk, was using a cane, and she's like 32 years old, like really having a hard time. She's been to all these doctors, multiple rounds of PT, nothing's working. And I get to know her as I'm working with her, and she's like, um, actually, after intercourse, my hip pain always gets worse. And so, in PT school, you learn a little bit about the pelvic floor, you don't learn a ton. But I remembered talking about it. It's like, you should probably work with a pelvic health physical therapist. And at the time, this, we were both working for this big health system, and there were pelvic floor PTs in the system. So she started seeing a pelvic floor PT like once a week, and then would come see me the second day of the week, or just like alternate every other week with who she was seeing. And she started getting better. She started walking without her cane. Her symptoms got better. Like by the time we were done working together, like she was like functioning normally and had minimal to no pain. And that was kind of a turning point for me. Like, wow, like the pelvic floor really is this super influential region of the body, that's kind of hidden, that a lot of PTs don't talk about, they don't know about, they should know about it. And so that kind of sparked my interest And then also how I could help dancers with that information, because as someone who had danced and wanted to serve that population too, I mean, turnout is all about rotation of the hips. You're told as a dancer to hold everything, tight, tighten your core. Like there's just all these cues that you hear in class, and that's just kind of ingrained. And so your pelvic floor is totally affected. And as I did more diving into information, like, dancers have pelvic floor dysfunction way more commonly than anybody talks about. So those are kind of the pieces that led me to pursue pelvic health.
So let's like really quickly, like what is the pelvic floor and why why does it matter? How is it involved? I mean, I don't want to ask you multiple questions, but like yeah, what is the pelvic floor? Why does it matter? And how does why is it so what's such a part of intercourse, aka sex?
I don't understand your question.
So like what is the pelvic floor and why is it important?
Okay. I have my pelvis. Should I just bring it
I
out?
mean, you can. A lot of this will be audio. You can do whatever you want. Just grab it.
Okay.
You can
Yeah,
grab it.
no.
I don't care. I mean,
I'll just talk
the
with it.
video will be up on YouTube, so yeah, grab it.
Sure. I'll talk with it and then, I'll try to describe it for our audio listeners.
Good.
Um, but yeah, the pelvic floor is just this group of muscles on the bottom side of the pelvis. So for those who are watching and can see, um, when kind of looking
It's
at
a
the
woman's
pelvis,
pelvis or female.
it is a female pelvis, but both individuals with male and female anatomy
True.
do have a pelvic floor. So with individuals who have female anatomy, the pelvic floor crosses three holes, the urethra, the vagina, and the anus. And then for individuals with male anatomy, the pelvic floor crosses the urethra and the anus. So you can just kind of be picturing that. It's like this sling of muscles on the bottom side of the pelvis. And they're very supportive muscles. They support your pelvic region, and they connect up into the hips and the low back and the abdominals. And then at the top of that, if you kind of keep moving up, thinking about the ribs, there are these muscles under the ribs called your diaphragm. Okay, they're breathing muscles. And so you can kind of think of a very simplistic way to think about this is sort of like a canister or a cylinder. So the bottom of that cylinder is your pelvic floor. So just kind of in a nutshell, the symptoms like that I would treat, or any pelvic floor physical therapist, things like leaking urine, pelvic pain, leaking stool, painful intercourse, tailbone pain, low back pain, hip pain, pelvic heaviness or pressure, which can occur whether you've had a baby or not, but is something that's more common in women postpartum. Symptoms associated with pelvic organ prolapse, which again, often a more common symptom postpartum. Um, I mean, I could go on, but those are kind of the big ones. Constipation, there's another one.
Yeah. You like float your own boat a little bit because like people will go to pelvic floor therapy and not have a good experience, and because like some people don't actually take a lot of things into consideration. So like or people go to their OB post baby and they're like, well, I'm having these problems, and they don't actually get help. So like what are some of the problems or the things that you think get missed when it comes to working with, the people that you're helping?
I think there's a couple layers to this. So the first thing that I've heard happen is, and this isn't every provider, so I'm not going to throw everyone under the same camp, but I've heard this over and over again. So it is something that's happening. Is that, you know, OBs at like a postpartum visit, for example, or even people who aren't having babies that are maybe like leaking urine or having some sort of pelvic floor dysfunction symptom, they're just told what a Kegel is and told to go home and do Kegels. And that's not going to be the solution. I would say for the majority of people, there are occasional instances where maybe just connecting in that way with the pelvic floor, which even knowing what a Kegel is something where there's a lot of uncertainty, to be quite honest. So
Oh yeah.
part of my role too is to help my clients understand what it actually feels like to contract and draw the entire pelvic floor up and into the pelvis, not just like a portion of it. And then the other piece of this is like learning how to let those muscles go. So I've also had instances with clients where they've been told to do Kegels and they do tons of Kegels all day long and their symptoms get worse because guess what? Their problem wasn't that they were strong enough. Their problem is that they're holding way too much tension all the time. And so I would say the other layer to that is, so number one, people are told to just do Kegels. Number two is sometimes that route will make symptoms worse and then they're more confused, right? And then the third layer to this, and this is an issue I see just, within physical therapy, specifically pelvic floor physical therapists, is we're not looking at the pelvic floor as a part of like our entire body system. It's isolated as like just this group of muscles on the bottom side of your pelvis, and all it does is affect pooping, peeing, and, sex. And I mean, when talking about the pelvic floor, I mean, when you're lifting weights, when you're running, when you're picking up your kids, when you're picking up a grocery bag off the ground, when you're jumping, like your pelvic floor is involved in all of those things. And so layering in managing pressure and developing tolerance to loads like jumping, running, lifting heavier, are also layers that are missed, I would say specifically in like rehab. So a lot of the clients that I work with who have seen other physical therapists, particularly pelvic health physical therapists, have been given primarily like just pelvic floor isolation type exercises, but they haven't been educated at all about how to lift in a way that's going to support pelvic health and how to progress with lifting or running or jumping. We've kind of just missed the mark. It's all like table exercises instead of moving people into the positions that they like live their life in.
Yeah. I mean, like we talk about this a lot because we go on walks together and we chat about this stuff. But
Occasionally we walk together.
yeah. Yeah, where'd you learn all this stuff, Mary? No, this is a leading question. So what are some of the things that, either people haven't been exposed to like a pelvic floor therapist or they've been just told to like live with it? Like, what are some things that you try to like questions that you ask to help maybe guide people to like getting a different opinion?
Like compared to previous care, is that what you
Yeah.
mean? Or-
Yeah.
I'll ask questions like, I'll ask about what their rehab looked like. Like just give me some ideas of what your rehab looked like. And if I'm given answers like, oh, we progressed to like pelvic floor contractions, like repetitive pelvic floor contractions, or just pelvic floor contraction holds, or all the PT did was release work. So whether that was with, a pelvic wand or literally the PT releasing the pelvic floor muscles, and that's all they did, we could be missing the mark. And again, those can be important layers. I'm not saying that those interventions are never helpful, but we're missing really important pieces to help somebody succeed with all the things they want to do, and longer term progress. Biofeedback too. Like
That's kind of like
I
somebody
don't see that. I have
just
not. I mean, I'll be honest, as a pelvic floor PT, I've never utilized it. I've never had to utilize it. So
yeah.
people get better with cues, with helping them understand their anatomy and actually what things feel like instead of, oh, do you see that that's lighting up so your pelvic floor is tight? Let it go, and just like staring at this, light that's telling them that there's tension, but they don't know how to let it go.
Yeah.
So just like more education and describing what to feel and talking about the anatomy, like literally getting the pelvis out and talking about what's going on, like that's way more helpful than some device that you're hooked up to that stresses you out, which actually is going to make your pelvic floor tighter. So there's
Yeah.
that.
I mean, it's all like biofeedback. It's like people throw technology at stuff without actually thinking about critical thinking about what's going on. Oh, we have a biofeedback machine. Okay, cool. Like, what is that? Like,
Yeah.
if you use it appropriately, great, right?
And
So,
again, not saying it would never help, but
yeah,
I just never had to use it and clients have success. So
yeah. What so like as what are you doing like now from like business and treatment like standpoint, where are you at? What are you doing now? This is a really
Yeah,
good
so
question.
it's kind of exciting because in like 2 weeks I'm celebrating a year of being on my own, which is super cool. So I'm working independently. I practice independently. I started my business, Inspire Movement, um, about a year ago, almost a year ago. And quite honestly, I have said this, that David, without your how do I say this? Your encouragement, your
Okay.
example, I probably wouldn't have done this, but I'm so glad that I have. So that's just a little aside, but now, I mean, there are a couple of gaps that I was seeing as a pelvic floor PT in a clinic. One was helping my more like athletic population clients like pick up barbells again, run half marathons, like jump on trampolines. I was super limited in my ability to help those people for a couple of reasons. Number one, the clinic I was working in didn't have any real weights in it, to be honest. And so the way I work with clients now, they either have home gym equipment, have a gym membership, or they come to our garage gym, and we can utilize our equipment. So one of those three routes allows us to have that access. And then again, the combination of either in-person care or virtual support, even like over a screen, like I can coach people through a screen with lifting and program workouts for them that help them progress back into those things. So again, that was just like a missing piece that I was like able to provide pelvic floor rehab quotes around that. And like birth prep support, and there were good things. I'm not saying I wasn't able to help people, but the missing link was for my more athletic moms. Like I
Yeah.
could only get them so far, or I only had so much influence. And I knew if I had more influence in their ability to get better, that they could get there, but there was just a gap in like rehab to fitness. Um, and so now I work with clients kind of more on a duration. So like 3 months or 6 months, so that I can coach them through the process of returning to specific activities. And it's typically either throughout pregnancy or postpartum. And all of their workouts are programmed. Pelvic floor rehab is integrated with strength training, or other like fitness goals that the client has. Again, it's completely individualized. So whatever that client's goals are, we'll like create a plan that works for them. The other thing that I see all the time is moms are super stressed when it comes to time. And so being able to create a plan that they can follow that again integrates their rehab with their fitness plan, rather than it feeling like one more thing they have to do or one more appointment they have to get to. It's just a lot more accessible. So I meet with some clients virtually. Again, I still do in-person sessions, but for most people, it's every 2 weeks or so. And then they have support from me over an app, which is the same app that they utilize for their workout programming. So if there's troubleshooting, like, certain exercises that are causing, leakage or pain or whatever, we can adjust that before their next session instead of them just trying to figure it out on their own in between. So I hope
What
that's a
are,
pretty good summary.
I mean, yeah, that was a very good promotional summary for yourself. So good job.
I mean,
Um,
you asked about it, so.
Turned into a spiel, which is good. What are misconceptions about birth that like you had or that people have? And like what are things that you have learned and you help people understand that, are like amazing?
Oh, so you're moving on to birth now. Okay.
I mean, I'm just like talking about, I'm trying to have a conversation instead of, like,
Yeah. No, that's fine. Um, yeah, so birth prep too is like, something that I don't think a lot of people know that pelvic floor therapists can help with, and what that looks like and what that means. Um, but yeah, there's a couple big things. So like number one, you don't have to deliver on your back. You don't. There's lots of positions that you can labor in and lots of positions that you could deliver in. And I think there's this assumption, I don't know if it's Hollywood, I don't know, and there is some like it's easier for the provider to do their
Who
job
is a
if
provider? What is a provider?
like the OB or the midwife, whoever's delivering the baby,
Perfect.
if if the woman is laying on her back, let's be honest, it is easier for them in many ways. And I don't deliver babies, so I shouldn't speak about that too much, but that is kind of the purpose of laying on
I
one's
mean,
back.
to some extent, and we like this is not being critical, but like what we have done in the past X amount of years is like medicalized birth, right? Which like
Yeah,
there are people who are like very anti that, and then we don't really know. There's pros and cons to everything, right? So
totally.
like,
Totally.
we've had discussions about people doing like home births that sounded horrific, right? And then other people like swear by it, right? So
Mhm.
it kind of depends on your risk tolerance and what you want and what you want your birth experience to be. But yeah, like this is something that I was not familiar with any way, shape, or form. But like, yeah, you could like deliver on all fours, right? Or like inside lying or, XYZ. So yeah, like
Yep, I recently had a client and she did do a home birth, and delivered in like a squatting position on like a squat tape chair. And she utilized a home birth midwife, but like she didn't have tearing, her outcomes were really good. Like she was really, it was good for her. It was great for her.
what
Um,
what's like the goal with preparing people for birth as best you can?
so number one is kind of just the concept that your uterus is pushing your baby out. Like you don't push your baby out. There are strategies to kind of assist the process, but you're ultimately not pushing your baby out. So this like again, kind of like Hollywood depiction of what birth looks like where, mom is purple pushing, meaning like pushing as hard as she can, bearing down as hard as she can. Um, it's just number one, not necessary, and number two, just like it's not helpful. And
Kind of
so
scary. It's kind of scary.
yeah, yeah. And birth can be way more peaceful than that. I haven't gone through it yet myself, okay, full disclosure, but like at the same time, like
Right, because
working
if
with
you would have and
clients.
I didn't know, it would have been a problem.
Yeah.
Maybe,
But
I don't
working
know.
with clients, lots of clients obviously who have and hearing about their birth stories, like the ones who really lean into the relaxation breathing, which again, the goal of that is to get the pelvic floor lengthened and relaxed so it gets the heck out of the way so that uterus can do its job. The ones who really lean into that, like they'll acknowledge that like they're not pushing, like their uterus is literally like making things happen and they're just kind of breathing through the experience. And then pushing itself, like there's a couple of different strategies that I'll teach. And one is with like an exhale, and which is open glottis pushing, is what we call it. And then closed glottis pushing is pushing with your mouth closed without air exiting. And sometimes it's helpful. It would be the option that puts more pressure on your pelvic floor and pelvic organs and potentially is harder to keep your pelvic floor relaxed when doing, but it's still a helpful tool to have in your toolbox, especially if you're asked to push that way from like your team during birth.
Hmm.
So yeah. And
What's
full disclosure, I don't have any biases on like where you like should be delivering or what kind of birth you should have. Like I support literally whatever the client in front of me wants to do, and we'll do
yeah?
our best to support that.
That kind of takes us to a good segue of like philosophy when it comes to like working with humans. Like what if you had like a overall arching philosophy, what would it be? Strength
Um,
and kindness?
that's yours. It's probably some derivative of that. Um, I should be asking you some of these questions.
No, I'm interviewing you. I'm just like, it's my
You
it's
told
my
me this
podcast.
was going to be a conversation, so
Yeah, but I mean, we can have a conversation. Like I
no,
mean,
this is
we
good.
have
This is
a
good.
tremendous influence on each other, right? Like, because we live
Mhm.
together and we are married and we love each other and stuff. But like I think one of the things that I get a lot from you is just kind of like accepting people where they're at because I'm very much like a fixer, right? And the more I've like you're genuinely like bubbly and like excited for people. Like even honestly, I've seen you interact with people who like have no business, like they don't deserve how like openly nice and kind you are, like, but you've still managed to do that. And I think I do a decent job of saying that. I'm not gonna throw myself in the boat, like I'm not a turd to anybody, but like yeah, like so I think just being kind and honestly energy too, like a lot of people just their energy, they lack energy like because of life, and you kind of can inject some of that in a very like meaningful and authentic way. So I'll give you some kudos to that. But is there anything that's like kind of changed since you've been more like, because it's your thing, right? I think that's one of the cool things about business is like it's your thing, so you kind of bring your own thing to it where somebody else might kind of stifle that. Does that make sense?
Yeah, yeah, like doing it for myself instead of for somebody else.
Yeah.
Is that what you mean?
Yeah.
I mean, to answer your first question, like my philosophy in interacting with humans, I think that I really, really do believe that everybody has something unique to bring, and there's always pieces of people that I'm not gonna know or understand. And so meeting people, like you said, meeting people where they're at, figuring out what their goals are, and doing my best to help them achieve the things that they care about without my own agenda. I mean, obviously there's things I'm going to suggest because I know as a doctor of physical therapy and public health PT, like things that will genuinely help them. But also making sure that they feel heard first, is really important to me. Because if you're not heard, like you're not going to give two craps about
What's the
what
difference?
I have to say or think, even if it's going to help you, right? So being, quick to listen and slow to speak first
Yeah.
and foremost. And sometimes I do have to bite my tongue. Sometimes it's really hard to listen to people. I'm not going to lie about that.
Yeah. Oh no, I know. I have 5 questions typed up and then I switched tabs and I got Instagram
Started talking. That's okay.
during that nice like listening, like, but listening is really hard. It's the ultimate skill and we all suck at it, right? So like it is true, and really it goes back to like Maya Angelou, like people want to be seen, heard, and understood. um
Hmm.
so, and like that's just the foundation of it, right? Because like this is me and you can talk about this too, like people's problems are unique, but they're not like that crazy different, right? A lot of times it's like, yeah, your problem, it's unique, it's your unique situation, but like it's not that different than like somebody else in a very similar situation that has gotten through it, right? And nobody wants to hear that type of advice, or like it's not even advice. Like we want to be seen and heard and understood so that we can hopefully move forward, right? So um when it comes to like, okay, so let's like we'll go into like strength training, right? Because
Sure.
did you ever think you were gonna be like lifting weights?
Not the way that I am now. No, no. I mean, as a dancer, right? um, it's just not something that you're like worried about bulking up, or like you don't you, as I don't know, that culture of dance land is just a unique place to be. But like nobody tells you that lifting is the way to become a better dancer. It's like, oh, be more flexible. Oh, go to Pilates. Like cross training and dance world, which I think this is starting to change. I think we're making some progress, some very slow progress, but like Pilates, yoga, or like do more cardio because it will make you slimmer. Like those were the kind of stories that I was told as a dancer. And also as a dancer, to be honest, that really didn't have, you know, like body image was not something that like I struggled with to the degree that like a lot of, my friends or other fellow dancers struggled with, just because of the culture of that scene. But the like, the body image is like a huge piece of that. Being slim is a huge piece of that, and it can be very toxic. So So just thinking about how you're taught to cross train, it's things that like you think are gonna make you skinnier or more
Yeah.
flexible. Like
It's
those are the
always it's always funny because like people like runners think of as cross training, like their lifting is still like almost endurance oriented, right? Like they're doing
right.
sets of 20 and it's like no, like really what you need is like sets of 3, right? Like to push your top end strength because you're getting a lot of endurance and like dancers unfortunately, first of all, like it's good that you like to eat, like and you don't have weird problems with food.
I do love to eat.
Yeah,
I love
which is good. And you don't really shy away. And you also don't like this is one of the other things that I am very neurotic. I'm probably very high in trait neuroticism. And you're relatively low in trait neuroticism, except for maybe control oriented things and home goods. But
yeah.
like you don't really obsess about stuff. Whereas like in dance culture or fitness culture, people get really obsessive about certain aspects of things, right? And
Mhm.
you mentioned so like because I remember before, before we were together, you would go to the gym. Like what would you do then?
I gotta think back because that was a while ago now. Yeah, I would probably like go on the elliptical for like it was like elliptical or like the treadmill for like, 20 minutes or something, and then do like some ab work on the mat, maybe like some planks. Um, I'm trying to think. Yeah, that was probably it. Um, and like definitely in college, like when I was dancing like 5-ish days a week plus rehearsals, like if I went to the gym, that's what I was doing, was like elliptical.
Still
It
cardio.
wasn't strength training. I
Yeah.
do remember using machines like a few times, like telling myself I was gonna get like strong, but it wasn't anything that I ever did like consistently, and I certainly didn't understand like what I actually needed to do to build strength over time.
What yeah. What what do you like what do you like doing now and what do you hate doing now?
Like in the gym.
Yeah.
I mean, I like squatting, but probably because I've done a million pliés in my life, so it just makes me think of like pliés in ballet class, like or like a version of that. And they're different, of course, but they're more similar than some of the other things. And honestly, squats and deadlifts, anything lower body, like just comes more naturally, probably too, just because that's again a region of the body that I've trained more my whole life, and upper body things I have had a really poor attitude about. But I'm working on that. And as I've been working on it, my bench press has improved. So, working on it.
Yeah. I mean, like I won't say anything there.
Oh,
That's just
go ahead. Go ahead. This is the conversation. You
no,
can.
it's just an overarching theme with like people like if you don't like at least embrace that like you could get better at it, like you're not gonna get better at it, right? Like, and that's we can joke and like I get that like there's a difference between me being your husband and like trying to coach you, and I think I do less and less
Oh
coaching.
yeah, there's a big difference, and I prefer husband.
The less coaching I've done, the better receptive you are to actual coaching, which has just been a learning process, and that's like me just suspending my ego to some degree. But like, if every time you're gonna try to do something, you're like, I don't like this, or you haven't even really given yourself an opportunity to get better, like it's not gonna get better, right? Like that's kind of the nature of a lot of things, right? So,
Yeah.
what's
Like I would say like now when I bench, I just tell myself that I can do it
yeah,
instead of being like pissed off about it. And it's actually helped a lot. So
yeah, I think who
for
would
anyone
agree?
listening, for
Yeah.
anyone listening, try that. It'll
So
help.
when it comes to like women and lifting, there's kind of it seems like there's people who are like gung ho about it or they're enjoying it. And then there's still the crowd. And I think we should also we'll address this too, but like there's also the crowd like who afraid of like bulking up or being manly. Like so what, what do you say to like somebody maybe who comes to you and they know that they need to like maybe improve their ability to like pick up their kids or be prepared to be a mom, right? and they're maybe a little bit hesitant or resistant to resistance training. Like, what do you counsel them on? What questions do you ask? How do you kind of help them through that?
I think, I mean, the first piece of it is like, I'll straight up ask like, well, how heavy are your kids? How heavy are your groceries? Like if I get the answer, well, I don't want to lift. I don't need to lift weights. If there's resistance like that, but maybe they're having leakage or a pelvic floor symptom or pain with specific things that require them to lift things. Because sometimes there is just this disconnect of like, wait, my kid's 40 pounds. So if you're only lifting 5-pound weights, how are you going to be prepared to lift up your 40-pound kid?
Mm-hmm.
Doesn't make any sense, right? Um, and then the other piece is like, okay, so if exercise is important to you, because most people say it is, like, rarely do I hear, oh, exercise isn't important to me. I don't care about being healthy. Most of the people that are reaching out to me that I'm working with they're trying to make a change so that they can live a healthier, happier life, right? And that may include like overcoming, pelvic floor symptoms. But it's like, okay, so like tell me about some things that you want to be able to do, or tell me, aspects of your health that are important to you. And like aging well always comes up. It's like, oh, well, I want to be like an active grandma someday, or like, my mom peed her pants like all the time, and I don't want to be that way when I'm, 50 or 70 or whatever it is. Um, so then the conversation of longevity comes up, and it's like, well, the best strategy for, like aging well, and this is for bone health, organ health, um, and simply just the ability to stay active and well, decrease your risk of falling. Like there's all these things, right? Guess what our best tool is for that? Strength training. And then kind of going into the conversation of like, this isn't something you have to do every day, like 2 to 3 times a week with, including major muscle groups is enough. Like I think there's also just this misunderstanding of like, to build strength, like you don't have to do it every day. It doesn't mean you're going to do
Yeah.
100 squats at your max every day. That was an exaggeration, but you get what I'm saying. Like I think
Well,
that individuals who don't strength train are worried that it's going to take up a ton of time, and actually it takes less time than trying to run 30 minutes every day, right?
I mean,
So
generally speaking, like where people go is that the notion of like fitness in a lot of our collective minds is like this 5 to 6 day a week type of thing where you go to a boot camp and you get the crap kicked out of you, right? And I've been there and I still love that type of stuff, but you have to realize what it is, and that's just a giant hit of dopamine, because you're just like working hard, getting sweaty, and like you're getting the like kind of the endorphin rush, but you're not necessarily like progressively training, right? And in a lot
right.
of ways that, and it's not like activity is really good, we both are going to promote activity, but when we hear somebody like who has never really like, and we don't want to like nocebo anybody or say like your squat forms the cause of your problems, but like when we hear about people going to like boot camps and doing like 150 squats a session, like every session, and we see like what their squat was looking like, and it's like, well, like it's not just that the squat doesn't look good, but it's also that you're just not very strong, and like this is not going to make you better, right? Like and you're not moving well. Like it's kind of one of those gray areas, because I don't like to like say that there's such a thing as like bad technique or that it causes injury. There is bad technique, but like you see some people lift and it's like, well, no wonder like you feel the way you feel, right? Especially if you've done it repetitively for a while. um
I think some of it too is just like, in group fitness, it's hard because an instructor is going to cue, okay, everybody squat like this, or like press through your heels, or keep your feet narrow and forward. And it's like, that's not going to feel good on everybody.
yeah.
That's not going to be appropriate for every person in that room. And repetitive movement in a way that like doesn't feel good is not going to keep you moving forward either. So
Yeah.
I think
I think the
be
amount of times
appropriate
where
for that.
we can be like the people will be like squatting with too narrow of a stance, and then like it hurts, and
Yeah.
then we're like, well, just widen your stance and turn your toes out and see how it feels, right?
Yeah. Create
Like,
some space there.
yeah.
Yeah.
And that's the individual nature of like this type of stuff. And but then it's also amazing when people like start to feel how like, and it's not going to be like a dramatic thing, but like over the course of 4 to 6 to 8 weeks, it's like, oh, I'm like lifting 50 pounds easily. Like that has a positive effect in your day. You just don't really realize it because you've leveled up slowly, right?
Yeah.
um
Yeah.
do you do you feel like, okay, so the bulking up is another thing. And like I always want to say this too, because like there are going to be people who do bulk up fast, men or female. Like their genetics are just, and like what I would consider bulking up is just building muscle fast, right? Like, but ultimately that's kind of a good problem to have. But most of the people who like bulk up like have been doing it and they've been training and eating that way for a long time, and they might even have indulged in the use of steroids, right? Like your mom is worried that your dad is gonna bulk up or is like gonna be turned into Arnold Schwarzenegger, like, right? Like that's literally, and she's kind of joking, but she's also kind of serious, right? And so, like, what do you think that stems from? Why do people feel like that? And like, why does it matter? Like, what do you think that comes from?
I mean, I think there's a layer to this specifically for women who want to be like quote unquote feminine, want to feel feminine. There is just like this cultural expectation that, I mean, look at like magazines and actors and actresses and just, what we see as like beautiful, like this definition of what beauty is. We think of like these slender women traditionally, or at least historically, like that is just the image that has been put into our head. And I think we are moving into a generally healthier place. But the other layer to that is like we also know that obesity is unhealthy. Like I'm gonna say that, like it's the truth, right? And so glorifying obesity, I don't think is the answer either. This is a totally different topic. Did not think we were gonna get on this today.
Well, I
Um,
mean, like
but
this is
but
the
but like the bulking up piece of it, I just think that like muscle is thought of as a masculine trait, or
yeah.
strength is historically and more traditionally thought of as something that is masculine. And again, we're moving out of some of that. I don't think we need to be boxed in by that. We shouldn't be boxed in by that. But like these fears, it's more like rooted in like identity
Yeah.
that is like actually looking at this stuff and number one, realizing that like you can get really strong and like not like look
Oh yeah.
like
I mean,
Arnold Schwarzenegger.
there's a
And
difference
then,
between training for hypertrophy and there's a difference between training for strength. And there's also just the neurological component of training, which if like if
right.
you're just really patient, you can get really strong without really change. Like you're gonna get muscular, but you're not really changing how big you are very much, right? And
But
like,
the other piece of this is like for women, like strength training is so good for us.
mhm,
It's so good for women.
yeah, it's so
Muscle
good
is a
for,
different organ. There's this hot topic of hormone health, right? It's like building muscle is so good for hormone balance in the
yeah,
body. And and it's something that, we just shouldn't be afraid of. And I probably feel better, like I don't know, I just like feel strong, and like my body feels good, like probably better now than any of the days where I was dancing like 5 to 7 days a week for multiple hours a day. Like being strong like feels better to me than that, like
yeah,
thinking back what that felt like.
yeah.
um
just
so
just to like go back, because like we don't have to get too much into the like, because we're not going to be judgmental about like obesity is a big risk factor, right? Like in combination
right.
with other risk factors, and that's what a lot of, I think, how we view our job and we view what we're doing as, is like we just got to manage risk factors. Like you can be bigger and be relatively healthy. At some point, it might be a thing that causes some amount of issues, right? But like in, you know, I can't remember the study name or what it was, but basically like independent, like if you exercise, like no matter how big you are, like your lifespan goes up, right? Like if you engage in meaningful activities and exercises, like you improve your health, right? And then you start
Right.
to add in other things, right? And then going along with it, like the conception of even like in like the power lifter or the like the strength world or the CrossFit world is often like more is better. And like this kind of segues us into like stress, but like more is not necessarily better like to feel good, right? And for like general like longevity. Um because there is like a certain amount of capacity and tolerance that we can, you know, manage until we like level up, right? So we talk a lot about stress and we kind of use that blanket word, but like what do you help people understand about like stress and like how that impacts them and their pelvic floor?
Um, totally. I think kind of redefining what stress is like a good starting point. That stress isn't just this like state of being where you like feel stressed out or like, are feeling overwhelmed. It's also like how well are you sleeping at night? Like, um, how are you doing emotionally? Like, are you feeling overwhelmed like 90% of the time? Do you have balance? Do you have social support? Like, what do your relationships look like? Because those can totally impact stress levels. Like, um, those are just some examples. But then also thinking about how our body physically responds to long term, even acute stress, honestly, but chronic stressors as well. And kind of in the context more of like, as a physical therapist, what are the things that we're working on more often? Things like muscle tension, muscle pain, having difficulty exercising because of those symptoms. And even looking at the pelvic floor, okay, which is also a place where we hold stress, or like emotional tension. It's a place that we protect, right? It's a vulnerable place. So we talk a lot about like stress tension in our shoulders, but like the pelvic floor is also a place that we hold emotional tension. And so I will see this happen, that individuals who have been under stress for longer periods of time, like their symptoms will potentially worsen during that time frame, like urinary leakage, for example. Like, and too much tension in the pelvic floor can create urinary leakage. But there's a couple layers to that, right? It's like the actual tension of the pelvic floor itself. There's like fatigue, and then also just the efficiency of the muscle working because of the tension. And then also thinking of the involuntary piece, right? Like your bladder reflexively contracts, which can play a role as well. So, and then the abdominals also play a role. So if you're holding tension, what's like a position of safety, the fetal position? So, just thinking about how stress can play a role in pelvic health. It's really, really an important piece of educating the clients that I work with, if that's a layer of what's impacting symptoms.
I just looked up if all animals pee when they're afraid. But peeing is it's instinctual physical response called submissive urination, right? Or it's like there I think that's part of like a fear response definitely a flight response. Like I think a lot of animals pee and then run, or they're like pee at like, you know, like they void and then they run, right? Like
Definitely in the oh, what's the book? The
why
zebra
zebras
book.
don't get old, why
Yeah, that
zebras don't
why
get ulcers.
zebras don't get ulcers. Yeah,
And I
there's
think like that's why that book is such a great reframe for humans, is because I think we still, for whatever reason, we think of ourselves differently than animals. But like when you start to pay attention to like animal behavior and like some of this stuff, at least from a behavior standpoint, like, and you know this, and I'm like pretty open about talking about like me being burnt out and depressed and anxious and how like I had the urge to pee constantly, right? Which is like a weird feedback loop. And it's also really common with people who are really stressed out, right? And some people call it like a psychosomatic thing, when like I think that terminology also doesn't do justice to the fact that like everything is psychosomatic, like literally everything is mind body, right? So like, but it's frustrating to feel the urge to pee all the time, and that becomes part of your mental makeup, and then you're trying to like fix it. I saw a post today, it's like the 6 F's of that keep you in pain or something like that, and like one was like being afraid of it, the other was like fixating on it, and the other was like trying to fix it. Like there's 3 more, but that's the other thing, like we try to fix stuff when we just really should just like live, like try to live, just be present and um enjoy stuff. And that's like one of the big things that like I think you want moms and anybody you work with to enjoy life, right?
Yeah, I mean, that's the whole point. That's literally the whole point,
Yeah.
is that these symptoms are so disruptive that, like, when I talk to, some of the clients I'm working with, I mean, they come to tears when they're asked questions about like why this matters to them,
Yeah.
because it's impacting their life so much, or it leads them to like avoid activities or miss out on things or say no to things that they actually wish that they could do or would want to do, but are afraid that they're going to pee their pants or it's going to hurt too much, so they're not going to be strong enough. And I see that happen a lot around the time that babies start coming into the equation, because um it's harder to find time for yourself. Like, let's just be honest. I had a cool conversation though today with a client who's about to offboard. And she said one of the best parts of working together was finally making the space for herself and recognizing that it wasn't being selfish. And part of what helped her realize that was she started noticing that when she would go to do her workouts, that her toddler, so she's currently pregnant with baby number 2, but her toddler was coming into the room when she was working out and like mimicking her. And
Yeah.
her husband observed this and he said, "It's really cool that our daughter is learning how to take care of herself from you."
Yeah. Yeah.
And like, she was like, "I was so worried about taking the time to like care for myself and pushed this off for so long. And now, like, in the process of working together, was able to see that like this is something that's helping instill like self-care in my daughter. And then, the next baby that we have, and like my husband thinks it's important too. And that's been super cool. So yeah.
Yeah. I think like, we talk about this a lot because like I think we've been fortunate enough to like work with enough people where it's like taking care of yourself is not selfish, because usually what happens is you can actually show up in life the way you want to, whereas like when you don't take care of yourself as best you can, there's a lot to this equation, but like usually you become dependent on other people and it makes other people resentful of you, right? And like that's a hard thing to like kind of accept. And then when it comes to like kids, it's like being a model for just behaviors that are positive, and not necessarily just about like snatching your waist, but just being strong and capable and feeling good. Like, and honestly, because like there's so much in like the diet culture and the being skinny culture that like working out was a punishment as opposed to just a way to feel good, right? Like that's really why like I have goals that I want to achieve, and they're like strength oriented, and that motivates me. But I feel better after every single workout I've done. Like generally speaking, like there's maybe a few that I'm like, oh, I shouldn't have done that. But like, and I will say too, you like we don't have to get too into this, but you're usually like sometimes you are a bit resistant to doing something, but usually by the end of it, you're glad you did it, right? Like that
Oh
is
yeah, I'm not gonna act like I want to show up all the time when I know I should. I think that's part of being human.
yeah,
But I mean, the other thing about that is like it's not even just about feeling good. I think feeling good is part of it, but it's also like showing up for yourself to make progress is also about being able to then like go jump on the trampoline with your kids, like instead
Yeah.
of watch on the sidelines, or um sign up for the 5K with your kids and not worry about, leaking or not doing it. Like it's like being a participant with your kids rather than, being the mom watching all the time because of how you feel, honestly. Um,
Yeah.
and if
I
you want to watch, that's fine. But if you're watching because you are afraid of like a symptom or whatever, like that's a different story.
Yeah. I think like, you are a very present person. Like you naturally are very present. And I am not, but I work on it. And I think like being present in what you're doing, the function of being here now is to enjoy your current experience, right? And things that detract from that, whether they be technology, whether they be stress, whether they be like pain, like those are the things we're really trying to overcome, like on a regular basis. And it doesn't mean that any phone usage is bad, right? Like it's okay to scroll TikTok or scroll Instagram for 15 minutes if it's just like fun, especially if the content, like I send you memes and stupid crap all the time, right? Especially if it's fun and you get a little bit of like a inspiration or a laughter out of it. But if you're just scrolling in ways that literally probably stress you out, like we need to examine this, right? And like the same thing when people, and this is the other hard part of life, and I'm ranting a little bit, but like we don't have very
You
good
are. You
we get
are.
well, you've been ranting too, so give me some but like life has never been more just non like boring, for lack of a better way of saying it. Like that we could literally fill our every waking minute with like entertainment or like triggering stuff, right? Or
Mhm.
and so like that's one of the real things that like working out has become for me is like it's a form of meditation. Like I'm literally, and you know this too, when I was really struggling, like there was a few panic attacks which sucked because it was like working out was my like time where I actually could actually feel like I was okay in my body. But for the most part, like when I would go work out, I was not stressing out about my symptoms, right? Like I was actually just present, and like that actually probably pulled me through until I had panic
For the,
attacks.
for the most part, for the
Yeah,
most part, there were a few workouts. It's like, why do I feel like this? But you were also like capable of doing the things that you were
exactly.
doing.
It was like me literally mind.
That's what I would remind you. I was like,
Yeah,
but you
which
just did X number of pounds, which tells me that
you're
you're
okay.
okay.
Yeah, which if you learn to be objective with yourself, that like can be a good thing, right? Because you're like, wow, I'm not feeling great today, but I still deadlifted 225 pounds, right? Kind of shows you that how you feel sometimes is not always true, right? Which we can get into that more and more. Didn't you say like that you felt like I was crowding you in the bathroom the other day when like I really wasn't, but you're like that's just what it felt like. And I'm like, yeah, like that's literally what being a human and being married is. So, um no, this has been good. I think let's go get burritos instead of making tacos just because it's time to
That
go.
sounds good
Let's go
to
get
me.
something quick
I think
and
that sounds
enjoyable.
good.
What
Yeah.
well, like let's really quickly dive into like you got give me 3 to 5 tips that, not like clickbaity stuff, but like your 3 to 5 tips for people, who want to take care like women or, like potential mothers, they want to take care of themselves. What are some things that you recommend like that are just really good general advice?
Um, if you don't know where to start with exercise, start with the ACSM exercise guidelines. Like, I think that exercise can seem daunting and it's like, okay, like what should I do? If you literally don't know where to start, like use those guidelines to put something together. So those
I mean,
guidelines are,
you want me to do it or do you want to do it?
sure, I'll say what it is.
I mean,
You can do
because I
it.
don't want you to botch it. That'd be a
I'm
big.
not gonna botch it. I know what it is.
What is it?
150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity per week, plus 2 to 3 strength training sessions that address all major muscle groups.
Yeah. It's
Did
technically
you really think that I
75.
didn't know that? I can't believe you. That was really
No, I'll mansplain it here. It's
how
technically
everyone
75
hearing
to
how we
100.
actually communicate with each other. This I cannot believe that you said that to me. Anyway, keep
What?
going.
75 to 150 minutes of it's a range, which kind of
It is a
equates to like
range.
progression. 75 to 150 minutes of vigorous activity, which is essentially like challenging cardiovascular work, right?
So I'm keeping it simple for the people
I
that
get
need
it.
it.
I get it. I'm just trying to
So
specify.
you can make it, you can do more, but like
Yeah.
150
Or
is moderate, which would be like walks,
like,
or
yeah,
75 minutes of vigorous, which would be like a HIIT workout, or maybe like jogging
jogging.
intervals
Yeah.
or
Riding your bike hard. Yeah.
spiking. Yeah.
Yeah.
Thank you.
You're doing good. I'm just trying to keep
Okay,
it.
so that's tip number one. How many tips did you say?
Let's do two more.
2 more tips. That Kegels are not the only form of like rehabbing your pelvic floor. That pelvic health symptoms are sometimes because things are too tight. But it's also important to learn both. So even if you're contracting, just like being aware of what relaxation feels like, because the other layer to that is sometimes if you're only working on relaxation, then it's like a temporary fix. So any client that I work with, it's like we're working on both contraction and relaxation, but it's also just to develop awareness of all the things. But just recognizing that Kegels are not the answer, put simply, like for everything, pelvic
They're a
health.
small piece of the puzzle.
Very small piece of the puzzle. Gosh, and a third tip. Hmm. Third tip. I'm getting tired. And now all I can think of is burritos.
It's good.
Oh,
I think the big thing
no, no, I got it. I got it.
perfect.
The third tip is pelvic floor symptoms / pelvic floor rehab is not just for like postpartum women.
Yeah.
Literally, pelvic floor dysfunction can happen at any stage of your life. You could be someone who quite honestly like has had multiple babies and not really had much for symptoms. But you hit menopause and you start having issues. So, I mean, there are like 20-year-olds experiencing pelvic floor symptoms who have
Yeah.
never had children, never been pregnant, any of the things. So, even though, pelvic floor rehab is marketed to women who are having babies, it can be present in anyone,
Yeah.
including men.
Yeah.
So
Yeah.
anyone.
I mean, on the podcast I was on with that guy Greg like a week and a half or two ago, like we talked like men pelvic floor dysfunction in the form of like erectile dysfunction is legit, and it's a lot of these things are like they're not just stress, but they are systemic stress. It's like, kind of, it's not even a great way to say it. Like it's hitting you where you live, where you care, right? And for men, a lot of times that's down there, and stress and anxiety and stuff like that is a wicked
I
beast.
mean, even like tight pants or having your bike not fit right can
Yeah.
affect the floor function
Yeah.
and male and female anatomy either. So
100%. Where
just
can people reach you?
my Instagram is kind of my first answer for that. So at Mary Hagerty DPT is my Instagram handle. So if you give me a follow there, you can DM me on there. And then I also have an email address if you listen to this and you don't have social media. So it's very simple, maryhaggertydpt@gmail.com. You can
Perfect.
email me if you have
Thank you.
questions or if you already want to connect. That's how you can get a hold of me.
Thank you so much for your time. I got to record like an intro to this podcast and then we'll go get a burrito. So
Great.
thank you
Thanks
so
for
much for your time. And
Oh, and I also want to just note that it's Valentine's Day week, and it's kind of fun that I'm on this podcast the week of Valentine's Day.
I made it to episode 2, which evidently getting to episode 2 means that you're doing better than like 97% of podcasters or something like that. So thank you
Cool.
very
Well,
much. I appreciate it.
if the Strength and Kindness podcast really gets going here, maybe I can be a guest again someday.
Perfect. I'll be back. All right. Bye. Love you.
Bye.